Good afternoon, everyone, and welcome to today's webinar, A New National Strategy for COVID-19 Response, Legal Opportunities and Challenges, brought to you by the Network for Public Health Law and the American Society of Law, Medicine, and Ethics. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on the Network's website shortly after the conclusion of today's event. We strongly encourage attendee participation, so feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them during the Q&A portion towards the end of today's event. Your moderator for today's webinar is Emily Carey. Emily is currently a 3L at the Sandra Day O'Connor College of Law at ASU. She has spent the past 2 years as a legal researcher in the Center for Public Health Law and Policy and the Western region of the Network for Public Health Law, and she previously served as the president of ASU's Health Law Society. She will be leading us through the rest of today's webinar, so Emily, over to you.
Great, thank you, Charles. Welcome, everyone. Thanks for being with us today. We have a fantastic webinar lined up for you on the latest national strategy for the COVID-19 response. So let me introduce you to our presenter for today, Professor James Hodge, who is the Peter Kiewit Foundation Professor of Law, the Director for the Network's Western Region Office, and the Director of the Center for Public Health Law and Policy here at the Sandra Day O'Connor College of Law at ASU. Take it away, Professor.
Okay, Emily, thank you so much, and good afternoon to everyone. Listen, we've got a jam-packed session for you all today. What we're going to try to do in regards to our specific assessments going forward is to cover just 3 really critical things. Things that I think will actually bring us into the fold in regards to where we stand at this nearly 1-year point of anniversary in regards to COVID-19. We'll talk briefly about epidemiologic trends, just briefly. You all know where we stand nationally on the pandemic as we speak. But then let's hone in on what's new, what's sensational, what's changing before our eyes in relation to the National COVID-19 Strategic Response Plan issued by President Biden 1 day after his inauguration. I will then, after briefly sort of explaining what's within the plan and some of the major highlights, and I'll be very brief on that to the full extent we can, making sure you get a good glimpse at what that 200-page plan actually looks like with all of its attachments. Let's hone in on the legal opportunities and the challenges ahead for seeing through an implementation of this plan and various different ways in which those issues may arise. Now, Emily and Charles both mentioned we'll be taking questions and comments toward the end of the program. Let me assure you, we have set aside a good amount of time for the specific session to make sure that you get to ask the questions that you want. Emily's got a great game plan working with me and Charles to make sure we get those across. Use your Q&A portion of set or WebEx here to issue any questions anytime, and Emily will be tracking them very systematically. All right, without further ado, COVID-epi trends. Gosh, to be sure, the facets of where we stand 1 year, nearly just a few days after the inception of this pandemic, counting on those early cases in the United States in January last year. It's unbelievable. I think we can all attest. And when you look at figures like what you're seeing on screen, you realize just how sensational the pandemic has been this past year. You know, deaths in the United States alone exceeding 440,000. We comprise 20% of all deaths in the United States, as President Biden's plan points out. We've got 4% of the global population, yet 25% of all known cases, 20% of all deaths. There's need to improve upon this systematically and strategically. That's going to be a big part of what we focus on. What you've seen and kind of basically experienced in the United States, you know, are 3 distinct waves, one of which at the very beginning, heightened and pronounced, another during the midsummer, and now this wave 3, though diminishing in the number of cases now as we speak, has been absolutely impactful, changing so much in how essential we need to respond in real time. What you're seeing at the bottom of your screen, that's a pandemic personified. These are the actual weekly deaths above and below normal since 2015, as nicely reported in the New York Times. Look at 2015, 2016, 2017, a slight uptake in the 2018 flu season, which was quite sensational. Then you get to the end and you see what COVID's done. These are excess of deaths above normal. That's a pandemic. That's what we're responding to in real time. Who's dying from COVID-19 in the United States, it's just very difficult to fully assess all the different impacts on populations across all different factors and sectors in the U.S. But to be sure, as we know through CDC data and otherwise, 81% of deaths in the United States are about persons age 65 and older. That's absolutely impactful. And so much of what we've been working towards to relieve in the U.S. and will go forward in regards to this national strategy. You'd say the good news is that means, in some ways, just 19% of persons under the age of 64 have expired from COVID-19, but that's literally people in every age range, literally at every year, and add that up over the course of the last year, 66,000 Americans under the age of 64 and under expired from COVID-19 directly. And I'm not counting all the excess deaths among persons all across the United States due to COVID-related implications in our healthcare system and otherwise. 54% of the deaths among males, probably an attribute of a lot of different societal factors, to be sure. Bottom of your screen across the column there, the health disparities on display in response to COVID-19 couldn't be more profoundly illustrated than through the actual number of deaths among blacks, Hispanics, Native Americans, all compared to white non-Hispanics, 2.6 times the number of deaths per capita among those select populations. That is a direct facet of the significant health disparities we've experienced with this pandemic. So to be sure, we've got some challenges ahead. The epidemiological trends, oh gosh, epidemiologists could go on for quite some time describing all of what's ahead. Real challenges. But to be sure, let's be clear of a couple. First of all, there is evidence now of long-term associated disabilities extending from COVID infection. We're honed in on deaths. Preventing them to the full degree possible is so essential. But we've got long-term morbidity to be thinking about as well in relation to the numbers, 25 million plus of infected Americans that we're going to have to think through. There's the substantial mental health impacts of COVID infection, as well as months-long of social distancing-related initiatives and closures of schools, businesses, life as we know it. The mental health impacts of COVID directly are one thing. We've documented specifically direct mental health impacts, COVID fog, COVID psychotic-related behaviors, but the actual impacts from a social distancing perspective on isolation and other specific points, so profound. We've got multiple vaccines authorized through FDA, thank heavens. Others are forthcoming. Good news on that front, more to discuss there. But the bad news is variants and mutations, of course, are challenging the nation even as we speak. Multiple variants, multiple mutations, some of which are not well understood in relation to what or how they may pose different risks, heightened levels of infection, and most importantly, whether or not the vaccines we have available will be fully functional in relation to preventing all known incidents of disease related to these mutations. We've got a lot more to learn about COVID, but to be sure, we're getting ahead of the game because what you saw occur the day after President Biden was inaugurated is what he pretty much promised in relation to his campaign. We're going to work on beating down this pandemic to the most significant degree possible. As President Biden now notes, it's going to be one of the most difficult operational challenges we've ever faced as a nation, underscoring his plan with key and deliverables and such that really do speak to the truth of that, so much so related to the specifics of what President Biden set out in day 1 through day 100 as top priorities for how to respond to the pandemic. It's very clear the Biden-Harris administration is making the pandemic the number one issue, obviously, to address in real time. There's so many different interventions working in real time to address these specific fronts. I'll highlight a couple of them now, but we're focused on that strategic plan for good reason. First of all, he's named Jeffrey Zients as our sort of COVID czar. This is a very interesting position placement because of what Jeffrey Zients is capable of doing. This is sort of known Mr. Fix-It within the White House and other arenas in prior administrations. The enormous responsibilities that he'll have in reporting to President Biden on all of these different coordinated activities across all levels of government at the federal, state, tribal, local levels. To be sure, they'll be working to coordinate with the Safer Federal Workforce Task Force that President Biden set up initially, working with heads of agencies on multiple subjects related to the federal workforce, which of course is huge. It has multiple ramifications, new testing methodologies and protocols, case investigation, contact tracing, requirements and limitations on physical distancing within these federal realms, enhanced structure to support telework. All good, all coordinating agencies, just like what you're seeing on the screen. That alone in the United States will be a massive effort just to bring in alliance these agencies working so hard now to actually work through every facet of COVID-19 response efforts, to be sure. However, The highlight of our session today, all the different facets of what we can actually think through is what is contained in this national strategy for the COVID-19 response and pandemic preparedness. Again, as President Biden introduced with Vice President Harris on January 24th, the day after his inauguration. What does it do? Big things. 6 primary domestic goals and one additional global goal that I'll briefly touch on. What and how the plan is seeking to change the game quickly in responses that are actually driven by science and data and public health, not politics, as President Biden suggests, are profound goals. First, restoring trust with Americans. Second, a massive comprehensive vaccination campaign. 3, mitigating spread through public health standards that are based on the best science, expanding emergency relief via the DPA, the Defense Production Act, and attempt simultaneously to reopen schools, businesses, and travel, all the while these other activities are occurring, and most importantly, perhaps in relation to what we've seen as essential to respond to this pandemic, promoting and working toward equity across racial, ethnic, and rural urban lines. These are profound goals and objectives laid out in the plan. Let's briefly take them on. I'll give you a quick snapshot of what each is designed to do. Again, the plan goes into much considerable greater detail. We'll hone in on the legal opportunities and potential challenges ahead. Goal 1, restoring trust with the American people. What are we going to do to actually implement clear public leadership and a commitment to a robust whole-of-government response? First of all, there's going to be a national COVID-19 response structure driven by science and equity, a promise made within the specific plan. There will be regular science-based public briefings. You've seen these already through White House Counsel or through White House Press Secretary, CDC now getting thoroughly involved. We will be publicly sharing data around key response indicators. As data arrives in relation to new information on COVID-19, the public will be made aware of it, transparent. We'll lead science-first public health campaigns as well to make sure that the science is what's driving so much of the communications and planning ahead. Goal 2, vaccination campaign, could not come along at a more essential time. The U.S. will spare no effort, as President Biden promises here, to ensure Americans can get vaccinated quickly, effectively, and equitably. There's so many facets to the plan related to this specific initiative. Let's highlight just 6 quickly. First of all, assuring safe, effective vaccines. 2 available as we speak through FDA authorization, more forthcoming potentially through additional routes. Johnson & Johnson's new single-dose vaccine may be up next for FDA authorization. We'll see. Accelerating vaccine administration to people and communities. No holding back on stocks. No waiting for the right opportunity. Get the vaccine in the hands of people who can administer it. How we're going to create new venues for people to be vaccinated. President Biden promises, I believe in the month of February, as we speak, the opening of 100 new FEMA-generated run clinics to provide vaccinations to Americans across the country, many of which are placed in areas most in need. Focusing on hard-to-reach and high-risk populations, so essential through vaccines, expanding the range of providers and ensuring they're compensated, people administering the vaccine, state, local, tribal authorities, others within the private sector, making sure compensation is there for the necessary costs, and the Fed's picking up the bills on all of that. And most importantly, in regards to remembering monitoring vaccine safety and efficacy all the way through. Mitigating spread, goal 3. What are we going to do to create a comprehensive national public health effort to control the virus? Vaccines will go a long way should they prove efficacious and we can get a wide swath of the American population vaccinated. But we're not done just because vaccination takes hold. As President Biden sets out in this plan, and executive orders issuing the same, there's now a national mask mandate applying to federal agencies, to federal contractors, and others anticipating and expecting they will be wearing masks through the duration of the pandemic. And a mask challenge to state, tribal, and local governments. Let's wear masks for the next 100 days. Let's make that happen because that will drive down the pandemic. Vaccine or not, it will drive it down based on the best science. We're establishing a COVID-19 pandemic testing board to unify approaches across states, effectively distributing tests, expanding access to testing, especially among schools. If we're going to seek for them to be reopened, we're going to seek new treatments and therapeutics. We've got vaccine. We've got some treatment options. We need more. Empowering CDC to develop an actionable, evidentiary-based guidance based on the best available new data. CDC back in the game, producing real-time guidance for states, for localities, for federal authorities. And then finally, they're expanding U.S. public health workforce and increasing clinical care capacity. We're talking about a massive increase and U.S. public health workforce. I'll give you a good sense of how that's going to occur as we talk this through in regards to additional goals, but it's extensive. Goal 4, defense production. It's past time, says President Biden, to fix these sort of supply shortages issues. Why is the United States, with the capacity to manufacture and the wealth available to us, experiencing these shortages? Well, obviously COVID-19 is a global pandemic, to be sure. But through the Defense Production Act and responsible efforts to actually control for multiple different facets of supply shortages across a range of different products, we can increase emergency funding to states and bolster FEMA's response efforts, fill those major supply shortfalls through the Defense Production Act, at least through responsible uses of it already underway through the White House, developing new pandemic supply chain resilience strategies so we don't find ourselves at this point 3 months from now again, or 3 years from now again, and improving distribution. Working hard to expand availability and control pricing of critical materials. Price gouging, other specific issues, fraud and such, rooted out and eliminated to the full degree possible. Goal 5. Now all this is good so far. We've got a lot of things at work to actually quell the pandemic. Can we reopen in real time as that occurs? President Biden suggests in the plan that the U.S. will be taking immediate steps to achieve a decrease in COVID spread. That's good. And it will simultaneously support the safe operation of schools, businesses, and travel. That's significant. Can you pull that off in real time simultaneously? If so, the plan lays out several different strategic initiatives. First of all, a national strategy to do so that states and localities, tribal governments, and others can follow with confidence about what and how we're working hard to protect the health of all persons within reopening strategies. Funding safe operation of child care centers and at-home providers. These places are often looked past as if schools reopening is the only thing we really need to accomplish. Child care centers, making sure they have available resources to reopen safely or to stay open safely. Support equitable reopening and cooperations at U.S. universities, colleges, so many of which are operating, including here at ASU, in various virtual ways. Protecting workers via OSHA and other federal safety guidelines. New mandates forthcoming from OSHA, the Occupational Safety and Health Administration, for the purposes of assuring safety within employment settings. Providing guidance to support safely open commerce and small businesses, most importantly, and promoting safe travel domestically and abroad. You've seen initiatives issued by CDC and others consistent with that last point F. To be sure, more on that legally in just a second. Final goal, we'll discuss systematically equity. The COVID pandemic, as noted, gets exposed and exacerbated, as President Biden notes, severe and pervasive health inequities among all sorts of communities, defined by race, ethnicity, geography, disability, orientation, gender identity. So many factors at work here. These are going to be tough to solve. The plan is committed to working towards those goals. First, by establishing a COVID-19 Health Equity Task Force with meaningful operational guidance for what it can actually implement and suggest back to President Biden and Congress for those purposes. Ramping up data collection to know health equity issues is driven in part by the data we have available to monitor for that. We need better data, and the plan's got laid out approach to how to accomplish that. Ensuring equitable access to critical supplies, tests, therapies, vaccines. Not suggesting it, ensuring it through mechanisms perhaps recommended by the Health Equity Task Force. Expanding access to high-quality health care. Exactly what you saw in the reopening, for example, of the ACA exchanges earlier this week, or actually late last week through CMS. A great effort to actually make sure we've got access to health care services, enhancing the social service safety net, and addressing risk for persons in congregate settings. Yeah, settings like prisons, juvenile centers, and other places, making sure those persons, from an equity perspective, get access to the essential public health interventions that will work to protect their health and safety as well. Goal 7 is not one for our purposes today to discuss in great detail. Additional colleagues nationally and globally are honed in on what and how the U.S. will become a reinstituted player on the global arena for the purposes of being responsible, equitable, and ethical, rejoining WHO, the World Health Organization, and so many other initiatives under the guidance of this specific plan as well. What do you see underlying this sort of 7-part strategy in this massive plan introduced the day after President Biden's inaugurated? Hey, here's what I see: a national vision for a healthier, safer America, hopefully coming to a community near you soon. How? Through widespread vaccinations at a clip and level perhaps not thought possible, now proving hopefully to be potential. Prevention via surveillance, via testing, via contact tracing, via masks, via every public health intervention already with proven efficacy for actually stopping something like COVID-19 in its tracks, using those efforts as fully as possible, focusing on equitable and uniform allocations and benefits, so essential, and then simultaneously reopening schools and businesses safely with substantial support, not just telling them get reopened when you can and do it under minimal guidance, providing guidance that makes that possible. This is the national vision for a safer, healthier America coming soon, hopefully, for all of us. But you know, the national vision doesn't exactly reflect the reality. So realistically, of course, what we know we're experiencing in the United States is discordant vaccination approaches across states. Sure, the allocation of vaccines has been out there since some of the initial vaccine was developed in the Trump administration, but to be sure, still widely discordant vaccination approaches and policies, clamoring for new supplies, not getting them, distributing vaccine supplies in distinct ways across states. COVID fatigue is overcoming the nation in so many different ways. It's not just about fatigue and being tired of having to adhere to closure and mask-related mandates. It's the social distancing and the social isolation facets that are starting to creep into communities all across the country. How long can we hold out is almost the way I think a lot of Americans are feeling. We're seeing disparate access to essential services and safe environments. We see disparate and distinct access-related concerns. And then the idea that we're going to get back to business at some point is a simple reality in many states. They've already been back in business. They've reopened across jurisdictions in so many different facets. Whether or not that proves to be problematic as we go forward, they're doing it as we speak. The reality facing America is we've got some significant challenges. Here's what you start to see emanating from the national plan. I think what you're starting to see is a really key theme, and it's going to play out with our legal analysis here as we go forward. First of all, you're seeing a very substantial shift, a change in responsibility to some degree in what and how we're going to conduct testing, screening, masks, vaccination-related issues, treatments, travel, openings, all of that, shifting to federal guidance, away from states, back to federal guidance. Not control over it, but just responsibility for how we're going to assess these things, how we're going to do these things smartly, equitably, with all the particular legalities in mind. And in return for that shift, what you're going to see back to states is better science, better guidance, better messaging, new data, best practices laid out based on what we can ascertain in real time, and substantial funding. As you know, President Biden is seeking mega funds through Congress right now and facing some obvious hurdles in that specific realm. What you're also seeing on screen here is something quite unique and interesting, I think, and we're really seeing now perhaps an attempt to actually federalize this response to the fullest degree. What might have been a state-centric approach in the Trump administration very clearly is becoming a federalized approach. That may carry dividends going forward for us, but also some risks as well legally. Listen, there are practical realities. You all see them. Everybody does, to how you implement this plan. There are significant costs involved, hundreds of billions of dollars of costs involved over months ahead. Logistics challenges, gosh, like you can't believe. Industry-related concerns at stake. We've got lobbies that are going to play their roles in relation to this, implementation issues that can't possibly be fathomed as far as how to do this as quickly as we possibly can with lives literally on the line, and infrastructure-related concerns as well. All of these are practical realities. None of these are what I'm solely focused on for our purposes. Let's focus on the legal realities. Let's talk about the potential opportunities ahead as well as challenges. There are significant opportunities, and there's some challenges too. We'll be brief here, get into your questions and comments in just a second. So without further ado, opportunities. Hey, we've got some mountains to climb. We've got some significant peaks to achieve in relation to achieving a healthier, safer, and open America. And along the way, what you're seeing across this sort of panorama are all the different legal opportunities for the full and fair and effective use of these specific legal powers in place for exactly what we're trying to accomplish. Under principles of cooperative federalism, using federal tax and spend powers, fully utilizing things like the Defense Production Act, the Public Health Services Act, PrEP Act, working through the full gamut of what the feds can do with their interstate commerce powers, achieving through national security recognition things we can't do otherwise through the states, and most importantly perhaps, fully understanding and utilizing the HHS Public Health Emergency, the Stafford Act Emergency, the National Emergency Act declarations, all in place, all of which wield significant powers at the federal level for accomplishing this. We've got really substantial legal opportunities ahead. There's no question about it. But there's also some issues as well. And just literally what you're seeing on screen are some of the types of issues I almost assure you in your jurisdiction or whatever role you're playing in regards to your role with the pandemic, you're going to experience something along this sort of kaleidoscope or such along the way. There's going to be issues related to how far the scope of powers go, issues of access, benefits, how much research can we do under what circumstances, what contracts are binding and when, how are we going to stop price gouging, what about preemption across the federal, state, local governments, what and how those impacts are playing out, privacy issues, civil rights norms, liability concerns like you wouldn't believe, duties, who's responsible for what, waivers of what regulatory and or other statutory provisions and when, and costs involved, all of which sort of emerge as law and policy issues, with one key finding I will suggest in relation to all of these. Spin the wheel if you want, land on any single one of them. I assure you there's an answer for these. These are solvable, every single one of them. None of these would stop and should stop a national campaign to bring this pandemic to its knees. They're all resolvable. It's going to take some real legal work on every part to make sure we do resolve these, but they're not known significant impediments. I see a few other hurdles as more problematic. These 5 hurdles actually might prove to be dicey, to say the least. Issues related to states' interests, constitutional rights, which the National Strategic Plan barely admits to any specific hindrances or issues there, not for discredited, but just doesn't bring up the constitutional concerns that may arise. Mobilizing personnel, I've talked a little bit about that briefly. Boy, is that going to be a hurdle. I'll show you why. Allocation-related issues and enforcement. There's a lot in this plan that looks good, it talks tough, and it speaks well as to what and how we can actually get a hold and get ahead of this pandemic. How far we're going to go with enforcement, it's going to get interesting. So let's break down these hurdles real quick, address a few of the key factors underlying each one of these, and end with a good message about what are we going to do on these 5 sort of substantial fronts. States' interests. Let's be clear. Everybody likes to talk about cooperative federalism, as does President Biden in relation to his approach. It's responsible. It's consistent with constitutional norms. It's not exactly what some states are resounding as we speak. Non-cooperative federalism. What do you do against that backdrop constitution when states don't want to play along, or localities don't want to fall in line with the plan's objectives? Tribal nations don't necessarily see them fitting within the specific realm as well. We already are seeing backlash at the state level, particularly among some jurisdictions, making it quite clear that they are not favoring these specific approaches. They're going to resist some of these initiatives. We've seen, for example, Florida Governor Ron DeSantis just the other day making very clear to President Biden, we don't need your FEMA vaccine camps. Just give us the vaccine straight up. That's all we need. We'll take care of it from here. Public health sovereignty, states in control of what they've been able to do, and so much vested with that control through state police powers. How far will this be gone in regards to how states express their interest and fight over these specific initiatives? How far are we willing to take the spending power limits? So, for example, the feds have one thing that goes beyond any state, considerably deeper pockets. They can pay for all of this stuff in relation to congressional authorization. It's a big question mark for how much and how extensive those payments are forthcoming. But can feds set conditions on those specific expenditures that could get to the point of unconstitutional for states being forced in that coercive environment? It's going to get dicey if and when the feds look to exert that specific interference or that influence. Constitutional rights are tripped up by several facets of the plan, not because they're irresolvable, but just because it's going to happen. There are vaccination requirements, not mandates per se, but expectations among Americans and states as well that are going to be viewed as mandates if states don't already package them in that specific light. That's going to trip up freedom of religion-related concerns. There's no question. Free exercise principles are going to be the source of litigation. You're going to see freedom of assembly and issues related to free expression being implicated as well. There are already in place travel-related issues through CDC now setting mask requirements on all forms of interstate and intrastate travel, except for auto vehicles on residential purposes, but all sorts of mass transit now requiring masks within the specific arenas. various different interstate and international travel restrictions, all of which could implicate these concerns, privacy issues, due process. These constitutional rights are going to be tripped in specific ways, and how we actually think and resolve them with the Supreme Court may be involved that we can't yet fully predict how the court will assess against the backdrop of some of its divergent policies in regards to anything as simple as freedom of religion and First Amendment principles. It's going to get interesting. Mobilizing personnel. So I talked about this briefly earlier, about the infusion of several 100,000 new medical and other personnel designed to bring about some of the mass vaccination efforts and other specific arenas as well. This is a sensational effort, and what you've already seen through an amendment to the PrEP Act, which actually allows for specific liability protections in other arenas in issuing and administering medical countermeasures like vaccines, is a recognition by the Biden administration that they are attempting to actually have states recognize fully all expired licenses of medical professionals and potentially temporary licenses of persons not yet fully licensed for the purposes of delivering medical care and vaccinations. Now, this is an interesting maneuver legally, and to be sure, it attempts to preempt any contrary state provisions that would get in the way of this type of licensure to expand that sort of public health workforce. But it's going to trip some wires. There's no question about it. From a licensure perspective, traditionally in the realm of states, scope of practice issues are going to come up all over again. The plan, though significant and does address factors underlying crisis standards of care, does not directly address these specific issues, and as a result, legality issues underlying that, all of which may extend from liability concerns about who's under what perception authorized to do what in real time. It's going to be interesting. Allocations of vaccines, of personal protective equipment, all the different things to the Defense Production Act that we're trying to acquire and work through in real time through federal interventions. All good, and certainly flooding the market with more vaccines and other initiatives will be a very positive development pursuant to the upcoming plan and its implementation. But we know from the Trump administration experience, specifically with HHS and with the guidance we saw through the Office for Civil Rights, any allocation scheme is going to trip on specific claims of discrimination, potentially related to disability, related to age, related to ethnicity or race or other issues protected under Equal Protection Clause. Even a failure, as some states are pointing to just a complete resistance to actually applying and sending vaccines to specific prison populations or otherwise over and above others on that phase scheme that the National Academies issues for vaccines. Hey, that's going to trip up Eighth Amendment related concerns. The allocations of this level of resource at this scale, in this limited duration, is projected to potentially lead to some really profound and interesting legal issues along these specific particular claims. And enforcement as a wrap-up hurdle. Gosh, enforcement in relation to what is possible under a federalized approach to how we're actually going to quell this pandemic, whether through moratoriums, new regulations, or new mandates. Will get interesting very fast. The moratorium you saw through the CDC was invented already, setting that eviction moratorium that my colleagues in the Eastern region of the network have worked so hard to actually assess and address based on some of the challenges out of Atlanta and other places to that. It's been unbelievable how far CDC saw its power going. Where else may it take this specific power in relation to issuing additional moratoriums or other further expansions of CDC's inherent ability to control for communicable diseases? The enforcement mechanisms underlying that, the extent to which those have been told by President Biden and others, will be interesting to see exactly how these are resolved. Regulations, President Biden has called on OSHA directly and quickly to address what it hasn't done as well leading into the new administration. And that is workplace safety at the highest level possible for assuring we're not actually communicating COVID-19 through methods that we could avoid even in essential industries and businesses. It is made clear in relation to that issuance of these new regulations that OSHA also will be out to enforce those specific measures on employers and others in a way that maybe it hasn't so much to date. Other federal regulations along those purposes with real enforcement teeth potential. And then COVID-19 vaccine mandates. All right, let's be clear. President Biden's plan does not suggest anybody, any American, will be mandated to receive vaccines. Doesn't make that clear at all. Doesn't have to. Right now, we've got a glut of vaccine or glut of persons all seeking vaccines and not sufficient supply. But we also know about a third of the nation in popular polling and such has made it quite clear a third of Americans aren't planning to get vaccinated with any version of COVID-19 vaccine. Against that backdrop, can you issue mandates at the state, local, or tribal level, which you even want to? And to that degree to which those mandates are issued for specific populations to potentially get vaccinated, you say, well, maybe we legally don't have to go that route, but at what point does the private sector start to communicate your ticket back to open society is you're proving you're vaccinated? Your ticket back to this stadium, your ticket back to this university, your ticket back to getting on this airplane is that you've been vaccinated. When and how that becomes a legal mandate, or at least perceived, is going to be interesting from a litigation perspective. All right, those are some hurdles. They're significant. There are other issues at work here. Question for us all, can we actually clear these hurdles to effectuate what President Biden's laid out in this sophisticated, extensive plan for the purposes of quelling the pandemic? Hey, I say you bet we can. But to be sure, these are the types of things I think we foresee forthcoming. Looking forward to questions and comments in relation to all of these perspectives. I'm going to turn it back now to my great colleague, Emily Carey, who will walk us through. She's monitoring the Q&A panel as noted there for how to actually issue a question that way. Emily, back to you. Lay on some questions and comments. We're going to get through as many as we possibly can in real time.
Great. Thank you, Professor Hodge. So let's start with this one. Executive actions and plans for national COVID coordination is one thing. Strong, sustainable investment and focus on infrastructure for the next crisis is another. What can the Biden administration do for public health and the American healthcare in the long term?
Okay, so I love that observation. And one of the really important reasons I love it is because President Biden in the plan foresees that. He sees that this is about rebuilding American public health infrastructure. You know it's so essential. Anybody who's experiencing everything across the COVID pandemic knows we got here because we failed to invest in infrastructure in many different ways over decades, not over an administration or one or two, over decades. All right, so with that said, I think one of the approaches you're seeing in relation to the plan that's pretty sophisticated is the following observation. We're going to build these specific interventions, better surveillance, better data, better dashboards, better sort of response mechanisms, a new public health workforce. We're going to build these with the notion that we're sustaining these for the long term, that we're going to be global players again, that we're going to be responsible for having the best science, the most innovative therapies, the best vaccination possibilities, which is an achievement for this country to lay claim to, obviously, for the long term, not just to beat down COVID, but to be prepared for the next major threat and or the routine day-to-day threats we all face from a public health perspective. I don't think President Biden can promise that alone, but I can say it's reflected in the plan. Emily, good stuff. What else you see?
All right, so next up, is it legal for an employer to enact mandatory vaccination requirements of employees if the vaccine is being mandated only available for approved public use through the EUA authority of the FDA rather than full authorization?
Okay, nice question, Emily. Thank you. And to be sure, the gist of this question is honed in on whether you can issue a vaccine mandate solely based on an EUA, emergency use authorized vaccine, as contrasted with a fully approved vaccine that FDA can only issue after it goes through multiple additional steps, and cannot do that obviously in real time in regards to the Pfizer, Moderna, or even the Johnson & Johnson vaccine. So listen, here's what's happening nationally. Employers are issuing some of these mandates right now in nursing facilities, in long-term care facilities, even some healthcare sectors. They're starting to come to terms with the fact that there will be an expectation and requirement. If you're working in this environment, you will be vaccinated. We're seeing, even I saw a report of a nursing school, a college, that basically said to all their incoming students, get vaccinated or don't show up to class. I think you might see that within other university settings in the near future too. The question is, can you legally do it? And the answer is actually, as my great colleague here in the Western region, Jen Pyatt, who's worked on several of these initiatives, has noted, yeah, you can. There may be specific legal issues at stake in your jurisdiction. There may be impediments to that, but as far as a general premise, if vaccination is proven safe and effective, as these vaccines have been to date, and vaccinating your employee population makes safer for all the environment in which you're actually treating patients or other particular persons, you got a plausible claim to mandate that vaccine for the purposes of persons attending. We do it with flu vaccine. We do it with other specific interventions medically. I think it's probably coming to a healthcare entity or service near you in the near future. Right now, though, we just don't have sufficient vaccine for a lot of employers to make that a mandate yet. Emily, good stuff. What else you see?
All right, so relatedly, this one is on mask mandates. So given the national mask mandate, specifically the mandates that we talked about for those using public transportation, are there any promising paths for the federal government to challenge states and governors who refuse to enforce the mandate? Would that be time well spent?
I love the time well spent part. Okay, I can't guarantee that. And the only reason I say that is not because it wouldn't be a great objective or achievement for the federal government to do, but let's be sure the fights over masks in the United States have some legal underpinnings, but it's a political fight in so many different ways. When you're going to win on those politics in specific jurisdictions is a question for you to assess in your own jurisdiction. Legally, though, do the states have options? Does the Fed have options for the purposes of assuring states, you really do now need to adhere to these mask-related requirements, even though they're issued just as a challenge at this point? Yeah, they've got options, and they may have to exercise them. The ability to control for interstate commerce, the capacity of CDC to fully regulate in the interest of preventing and controlling for communicable conditions could extend beyond some of what you're seeing CDC utilize its powers for, even early into the inception of some of CDC's new sort of push for this sort of interstate, intrastate travel issues. Yeah, I think the feds do have additional levers they could pull on this, including spending power-related concerns. Would they pull it? Why would they do it? Under what circumstances can we obviate that? I think everybody's working hard to avoid that because of the obvious political repercussions. It's a great observation, though, to be sure. If they had to design a legal strategy for the feds to mandate it, it's there. It's just one they're not seeking to take, I think, at this juncture. Great question. Emily, what else?
Okay, back to vaccines. I read the Biden admin wants to allow retired nurses to administer vaccines. What are the implications for the organizations who use retired health professionals to administer vaccinations?
Okay, nice point. You heard right. That's exactly what the Biden administration has put into place right now. So the PrEP Act provision I just mentioned to you, what's known as Amendment 5, came down on January 28th, and the Fifth Amendment of the PrEP Act makes clear they want to make those sort of retired nurses, retired physicians, anybody in the healthcare sector that can actually administer vaccines, they want to sort of reinitiate those licenses. They want states to recognize those licenses as legit, and they want those persons back in the public health workforce with whatever particular volunteer or employee capacity they can possibly entertain. Now, to that extent, let's be clear about a couple things. First, this is not just about relicensing persons. This is about recognizing their existing license as good, even though it expired. Second, you're not going to vaccinate people the very next day. There will be a CDC formal training that they expect those persons to participate in to get up to speed on exactly how to vaccinate effectively. But yes, to be sure, what you heard in regards to this new effort at the federal level to essentially guarantee licensure of these retired nurses and others is an essential part and component of the push to actually expand the national public health workforce. It's underway as we speak, literally at this moment, thanks to that PrEP Act amendment. Great stuff, Emily. What else?
Okay, so the plan emphasizes pushing science-based information. However, it seems that much of the U.S. population has lost trust in science altogether, especially from federal agencies. How does the plan intend to address this deeply entrenched distrust?
I know. It's such a great observation. Vaccine hesitancy, distrust of government, so many factors at work here. Listen, one of the things that President Biden starts with in the plan is that recognition. Goal one, reestablish trust with the American people. How do you do that? Related to sort of backing up science with sort of communication strategy. Our colleagues in the southeast region of the network, Gene Matthews and Don Hunter and others, talk a lot about the sort of communications goals, how to be effective in relation to that across political boundaries and such. It's so essential. But to be sure, this plan, what it does is sets out real targeted goals for effective public education and communication strategies that are designed to actually, first of all, be transparent in relation to what we know about the science. Second, to have decisions about how we respond to COVID-19 based on science, not on politics. And one of the good uptakes of that, I think, that will be a realized issue from legal and ethical and other perspectives is that once you start showing Americans through transparent, scientifically driven initiatives how to respond to COVID-19, there's a very good outcome. Those interventions work because they were science-driven. I think that initiative underlying establishing trust in the American people through this specific plan is as well laid out as you can imagine, although the techniques for how to accomplish it will take a lot of effort on the federal, state, local, and tribal side to make sure it comes to fruition. Good stuff, Emily. So what else are you seeing?
Okay, this one is about schools. Can governors really force schools to reopen, i.e. is a mandate to reopen enforceable? For instance, are there any examples of school systems that have been denied funding or resources for not reopening, as some governors have threatened to do?
Sadly, yes. I am aware of some school systems that have, against the backdrop of mandates or expectations to reopen in real time. You remember that sort of initiative back in September, President Trump backing some of those specific initiatives, that, faced that from their own state's administrations of their resistance to reopening because of the sheer risk that they foresaw among teachers, staff, and students within those environments. So if you're asking if there are examples of that, the history of this pandemic has revealed that. There are examples right now of whether or not schools would be willing to reopen, but there's also the flip side. Schools that actually, like in Oregon, I understand Oregon Governor Kate Brown has made very clear to her schools in that state, we're planning to reopen well ahead of schedule of what President Biden says in the next 100 days. Let's not wait around until April, so let's reopen as soon as we possibly can. At least some reports out of Oregon suggesting that's one of their major initiatives and attempts to do. Can they do that? Sure. Is that under their control? Absolutely. We've looked at these issues over years. And to be sure, when and how schools reopen in the United States is a state and or even local decision, legally speaking, related to the very best guidance possible. It's not necessarily one that could be driven by the federal government, even through the Department of Education. Now, here's one additional facet to be clear on before we take that next question. The feds do have something that schools will want. And if they want access to the funds that the Department of Education can dispense, some of what you may see is at least a greater and larger push, at least among federal guidance, to assure that schools reopening do so consistent with those safety standards as a potential for gaining access to some of those funds. Now, I'm not suggesting that's federal policy at this point. Let's just know it's a lever that the feds always have at their disposal, setting conditions on the receipt of those Department of Education or other CDC or other funds to schools directly to assure that they do meet the standards and parameters for safe reopening. We'll see if the feds go that route on these fronts, but to be sure, the plan admits the possibility of that, at least to a degree of implementation. Emily, good. What else?
Okay, so if the Supreme Court recognizes a free exercise right to be exempted from COVID-19 vaccination, can public health authorities still limit activities among those who are unvaccinated? Oh,
wow. Neat question. Now, listen, you asked part of that, Emily, in a way that we don't know the answer to. Yeah, we have no idea whether the U.S. Supreme Court would actually go so far, unlike in prior cases, to actually affirm that there is a free exercise right to be accepted from COVID-related vaccination. We don't know that. It may make that decision if it follows what you saw recently in late November in regards to its assessment of free exercise interests and rights around closing religious congregations and such, as per New York. It could go that route. And if it did, it would get interesting as to what and how far the Supreme Court views that religiously grounded exception under First Amendment principles to take for the purposes of assuring against having to be vaccinated, even against the backdrop of states saying, well, if you want to participate in these activities, you're going to need to be vaccinated. So here's my answer to the question, though, just to explain what you're seeing in real time. My answer to the question is as follows. I think even the U.S. Supreme Court, in its wisdom, would recognize and understand one of the really core exceptions to even that free exercise interest. And that is, what you don't get to do if you don't want to be vaccinated is put others at harm. You do not get to place others at risk. Even with known school vaccination requirements that set religious exemptions acknowledged by state courts at the very least, everybody recognizes if we have a population of school students who are unvaccinated and the measles outbreaks at that particular school, those students can be sent home constitutionally. You can tell them for a period of time, you're going home. We cannot risk you spreading measles to others or you getting it yourself. Now, with that in mind, I think the limit you'd see to that free exercise right would be if you as an American adult don't want to be vaccinated and you claim your religious exemption, you might just find yourself on the outside looking in relation to certain other government benefits that require vaccination for the safety of all. Now, it's going to get dicey, and I bet you in the next year or two ahead, we're going to see a decision that makes this even more interesting. But to be sure, that's a forthcoming issue. Great one, Emily. Thank you. What else you say?
Okay, so on to another branch of government. People are wondering about Congress. So what plans can be undertaken through executive actions and existing emergency authorities versus what will congressional support need to achieve? Now that Biden is president and the House and Senate have Democratic majorities, what can Congress do to address the pandemic?
Okay, so Congress can play a huge role in relation to addressing it, as many state legislatures are attempting to do, and some maybe less so advantageous than others. But let's actually highlight a couple quick things. First of all, when you read the national strategy, it reads well, but it's also backed up by a dozen plus executive orders and other memorandum from the president signed and put into place for the purpose of assuring we're going to implement this plan to the full degree possible through the executive branch to the extent without congressional need to interfere or to get involved for those purposes. So it's backing it up with executive orders and other interventions that are going to make a critical difference. That's one part. But yeah, the questions driven around what role Congress plays in this realm. Well, you know, one of the biggest is obvious because President Biden is seeking specific funding allocations through Congress as we speak. There's a lot in this plan, a lot that can't get done if we do not get additional resources for those purposes. Now, there's quite a bit in this plan that we already have in place, sufficient contracts, sufficient procurement strategies, specific resource slush funds for the purposes of making sure we can actually start these initiatives. But new funding will be absolutely essential. That's why there's a $1.9 trillion request out there through President Biden. And some of these other interventions the plan admits would require congressional authorization to do in real time. And those interventions are ones for which you're going to have to see Congress get involved and literally have to turn around a piece of legislation to effectuate some of these initiatives. That's yet to be seen exactly how far the plan may go for some of those purposes, Emily, but I can attest when you read the plan fully, the president does understand Congress is a major player. Congress has to provide the funding, and appeals already moving in for that purpose. Good stuff there. What other questions? I know we're drawing close to the end of our hour.
Yes, we have time for a few more. So next up, how do we work at the local level to ensure that older Americans are vaccinated in a meaningful way within their limitations? Technology is becoming a barrier for access to those who lack computers, internet, and capabilities to go online and register. Does the plan have anything in order for this issue?
Okay, nice point. It's a repeated situation across the United States. We all know it. We've all heard it in our jurisdictions. How do you get in line for a vaccine when you lack technology to be lining up and signing on board through these, sort of state-run databases or dashboards or otherwise to try to get within those parameters? Real Americans on equitable related issues facing significant hindrances to even just get in line for these vaccines, even when they're designated by their own state's health directors or governors as, suitable for the purposes of receiving vaccine. What a significant issue. And to that end, a few initiatives within the plan designed to address. First of all, with that national campaign for vaccination, it's sophisticated as far as how far the feds may have to go for the purpose of implementing it. Don't forget, there are new vaccine clinics that will be arriving in your jurisdictions as we speak, based on President Biden's plan to open 100 new clinics in the United States in the next month alone. There will be a flood of new vaccine as soon as 200 million new doses are delivered, as President Biden has ordered through existing vaccine suppliers. The potential for that additional 1 or 2 or even 3 new vaccines, particularly Johnson & Johnson's single-dose vaccine forthcoming, to flood the market, to actually create a situation where it's not necessarily that single database that you need to go through at your local government so that senior citizen or other can get access to the vaccine. It's Walgreens. It's CVS. It's get yourself to that next pharmacy for the purposes of assuring your access to it. That day's coming. It's a logistics challenge, not so much a legal. But right now, navigating and working through as many different ways possible to help on an equitable front, persons gaining access to those vaccine allocation networks and such, so essential at this point in time. It literally could and will save lives, and to be sure, I know a lot of states and localities are working towards perfecting those efforts as we speak. Good stuff, Emily. What else is it?
Okay, so we have some great questions. I think we have time for one or two more. So here's one. As of now, has the Biden administration mentioned any plan regarding handling COVID in long-term rehabilitation centers and nursing homes?
Okay, so I think within the plan, you see definitive attention to at least the profound impacts of COVID-19 within its environments, the profound need to actually allocate vaccines directly to those specific environments. And based on my review of the plan, yes, there is some elements that will play out well related to long-term care facilities directly. But I will at least also say they're not a targeted focus within the plan directly for the purposes of assuring how we're actually going to adjust for COVID-19 impacts within that specific setting. This isn't, in my view, an undersight of the report itself. It covers so much ground in so many different ways. I think what you're seeing in the plan is that there will be a definitive sort of handoff to Jeffrey Zients and to others working through these specific arenas to make sure those specific facilities are getting among the best received care possible for the purposes of preventing death, because clearly, as we've seen with the FDA of this pandemic, that's where deaths are occurring at too high of a clip, especially early in the pandemic. Vaccines already undertaken in those environments. But yeah, it's a nice point. Whether or not that's a priority scheme that you see within the pages of the plan as contrasted with an implementation issue, I see it a little bit more in the second. Emily, good. What else? Maybe one more last question?
Sure. So this one's an interesting one. What practical legal effects does President Biden's classification of COVID-19 as a national security threat carry?
Okay, now that is interesting. Here's why. The president, like President Obama, and with Ebola, in the past in 2015, and President Trump, in relation to his assessment through his administration of COVID-19, President Biden does recognize COVID-19 unquestionably as a national security threat. And why has that become so interesting? Well, for a couple of reasons. First of all, the feds and the feds alone are responsible for national security threats. I mean, they have to rely upon state and locals to play along in relation to federal schemes in responding to that, but national security threats are, by constitutional design, federal responsibilities. How we address for those, how we adjust those, how we respond to them are federal parameters and federal priorities. When you take those national security powers, which are distinct from, like the National Emergency Act powers and the Stafford Act powers, the Public Health Emergency powers, when you look closely at those national security powers, you see a bevy of potential operational issues that the feds and the feds alone could potentially utilize for the purposes of responding in real time. As COVID consistently is viewed by administration after administration and or future public health threats as national security threats, I think increasingly what you're starting to see is a federalization of how we're going to respond to these issues going forward. Now, obviously, anybody could say, well, of course, COVID-19 with national impact should be a federal approach. Yes, that's true. It just maybe wasn't quite the priority of the prior administration. President Biden's administration seems intent on using national security and other specific powers to federalize these responses. And I think what will get interesting over the spring is that assessment of just how far will they go in relation to that exercise of those constitutionally vested powers in the federal government to respond to those types of threats. Great point, Emily. Thank you so much. I dare say we should turn it back over to Charles for some of our final comments.
Great, thank you. And thank you everyone for your participation in today's webinar. Just a few final notes to our attendees. All attendees will be receiving an email from the network with the video playback of this webinar, as well as a link to our brief webinar survey. The survey just takes 1 minute to fill out and provides us with some really great insights. And you will also be receiving an email from ASL and me with information on how to apply for CLE credits for today's events. That concludes today's webinar. Thank you all for attending and have a great rest of your day.